The use of AI to reshape healthcare. Well, that's a very popular question that we get asked nowadays. I would say that probably the most important, valuable thing, besides any single one application, which is commonly cited, is the fact that AI will be really used to seamlessly blend and optimize all the other tools that we have today. In other words, if I have a great application that is used to characterize stroke or a tumor, right, that acts in a little bubble by itself today, the use of AI will enable the relative ease of that tool to actually live and thrive in a larger ecosystem, right? It's no longer going to be a single application that the radiologist or physician will have to manually bring up to speed. It's really something that's going to live and breathe in a larger ecosystem of healthcare applications. So, in my opinion, I think that's really where a lot of the greatest value can be had. The most promising applications. Well, I think it's actually quite interesting, looking around at the Canon booth this year. I think that much of the investment is exactly on the one area where we're going to see the most benefit early on, and that's in the area of image optimization and acquisition. So really much focus has been put on those single applications that diagnose or detect a disease, but in fact it's the applications before the AI even gets to that stage that are most readily solvable with today's technology, and really serve as the proper foundation that we'll need to eventually downstream build the applications we want. So things like denoising or super resolution or decreased acquisition speed, these are really the tasks that we're going to see a very tangible outcome in the very near future. Well, again, it's actually quite remarkable. As a AI practitioner, I am privy to what just about every vendor in the world is doing right now, and it is actually quite impressive the amount of effort and focus that has been put on that specific area of research here at Canon. So I would say without question in my mind, it is an industry leader in this specific area. One of my first initial large-scale works in this area in recent years was the application of a deep learning AI system for hemorrhage detection in a non-contrast head CT. It was received quite well, in part because it was one of the first of such applications in that field, and also because we studied over 10,000 patients in that first trial. Again, at that time, it was one of the largest and sort of the most deliberate kind of work in this area. And though I was a trainee at the time, I was actually just finishing up my fellowship in San Francisco, I was very graciously awarded a prize to sort of have that piece of work stand out. So again, it's something we're quite proud of, and it's in fact a technology that is actively being integrated into the stroke triage pipeline here as in the automation platform at Canon. Improved patient outcomes. So that is ultimately, when we think about assessing these AI tools, I think it's a often forgotten upon metric, because as radiologists, right, we're sort of very focused on the image. But at the end of the day, in order for a tool to be valuable, right, it has to really make some sort of impact on the bottom line towards patient care. Now, this is an interesting topic because at large academic centers where most leaders practice, we tend to already practice in a setting that is completely optimized in almost every way possible. So to be very honest, the impact of AI on our workflow, at my workflow at Irvine, is quite limited. However, as a large tertiary referral site, most of our patients actually come from our nearby community partners and a large catchment area that may be hundreds of miles large. A patient with stroke, for example, they may go and essentially be triaged to a community center first and then get referred to us for further treatment if it warrants it, right? In those type of settings, the optimizations, the workflow, ability to be streamlined using AI is so valuable, right? In stroke, really the difference of 30 minutes or an hour can make a difference between whether a patient is amenable to treatment. So even if we're able to treat 10 or 20 more patients a year because an AI has rapidly diagnosed their disease process, would dramatically impact patient care. The challenges of AI in healthcare, certainly that's another very pressing and important topic. I would say without question, the biggest bottleneck we have in our work is that AI tools that we develop in one setting are not guaranteed to work when we move them to another. So if it's a different patient population or even a different practice setting, we've seen actually time and time again that the models tend to underperform to what we would expect because again, the AI has really learned to completely hyper-optimize itself to one specific data program. And so I think a lot of active work is being done in this area. One idea is to simply aggregate and accumulate more patients for your AI models to learn from, with the thought that eventually you should capture enough diversity that you will be able to properly generalize to a large setting. Another concept and thought that's being thrown around is that perhaps we don't have any one single algorithm that generalizes everywhere, but instead a handful of algorithms that are specific for certain patient populations, for certain hospital settings, and that in order for a tool to be successful, we need to create an entire ensemble of these to generalize properly. So I think it's an unsolved question, but without a doubt in my mind, probably the most important thing that we need to tackle before we see large-scale adoption. Well, I would say in our field, one of the unproven questions really that we have at large is exactly what type of cost savings we can expect with the use of AI technology. Now, again, it doesn't seem apparently obvious because as physicians, right, if it just makes my life easier, naturally I would want to use it. But for my hospital administrators, for really the leaders that are making decisions, I need to prove that there's some cost savings to this system. Now, this might come in the form of something as simple as me reading cases faster, but even more so if we can prove some sort of reduced turnaround time in the emergency room, a quicker discharge time in the hospital, really anything where you can prove even 10 or 15% marginal benefit, that would make a dramatic impact in our healthcare system. And so to me personally, that's what I think will be critical to reach wide, large-scale adoption in the near